friends, today our topic of discussion is on the multiple sclerosis. What is it? Let's discuss. See, multiple sclerosis is an autoimmune disease. Okay. With these conditions, your immune system mistakenly attacks the healthy cells. Here you can see this healthy nerve cell. It is. So, in people with this multiple sclerosis, the immune system attacks the cells in the myelin. Here you can see this yellow portion. This is myelin. Okay. Which is the protective sheet that surrounds the nerves in the brain and the spinal cord. Okay. So, resulting in the damaged nerve covering, or you can say these damaged areas develops the scar tissues. This gives the disease its name, multiple areas of scarring or a multiple sclerosis. Clear? Clear. Next we will discuss why the multiple sclerosis is called sclerosis. See, the term multiple sclerosis refers to the distinctive areas of the scar tissues or the sclerosis, also called the plaques or a lesion, that results from the attack on the myelin by the immune system. Okay. Next, one more interesting thing we will discuss. Where did this word multiple sclerosis originates from? See, the multiple sclerosis was first described in the 1868 by the French neurologist Jean-Martin Charcot. The name multiple sclerosis is just short for a multiple cerebrospinal sclerosis, which refers to the numerous glial scars or a sclera, essentially your plaques or lesion as we discussed, that develops on the white matter of the brain and spinal cord. Okay. So here you can see this damaged nerve covering. So the damage to this myelin sheet interrupts the nerve signals from your brain to the other parts of your body. Now you can see this, it will disrupts the communication between the brain and the body. So the damage can lead to the symptoms affecting your brain and spinal cord, and over time it can lead to the vision problem, muscle weakness, loss of balance or numbness, etc. Okay, next we will discuss it in detail. What is it? See, multiple sclerosis is a chronic, progressive, non-contagious, degenerative disease of the central nervous system, characterized by the demyelination of the neuron as we discussed. Multiple sclerosis usually occurs between the age of 20 and 40 and consists of the periods of remissions and exacerbation. Next, what are its causes? The causes are unknown, but the disease is thought to be result of an autonomic response or a viral infection. Now, what are its precipitating factors? See, the precipitating factors include pregnancy, fatigue, stress, infection and trauma. Now, we will discuss how we can what are the diagnostic tests for this disease. See, first is electroencephalogram and second is lumbar puncture. Electroencephalogram findings are abnormal in this case in the multiple sclerosis, and a lumbar puncture indicates increased gamma globulin, but the serum globulin levels is normal in this condition. Clear? Next, we will discuss about assessment, how we can assess this disease. The patient may have fatigue, weakness, ataxia. Ataxia means impaired balance or coordination. Vertigo. Vertigo, you all know, is a sensation of motion or a spinning that is often described as dizziness. Or you can see the vertigo is a sensation that the environment around you is spinning in a circles, like that sensation. Okay. Next is tremors and the spasticity of the lower extremity, Parasthesias. Parasthesias means refers to a burning or a prickling sensation that usually felt in the hands, arms, legs, feet, but can also occur in the other parts of your body. Okay. Next is blurred vision, diplopia, nystagmus. Nystagmus is a vision condition in which the eyes makes repetitive uncontrolled movement. Clear? Next is dysphagia. Dysphagia means difficulty in swallowing. Next, decreased perception to the pain, touch and temperature. Bladder and bowel disturbances including urgency, frequency, retention and incontinence. Here you can see in this image what are the symptoms of the multiple sclerosis. Discuss the poor balance and coordination, also called ataxia. Visual problems will be there, speech problems will be there, spinal lesions, suppressed immune systems, muscle loss, sexual problems, bowel and bladder complications, nerve damage and numbness will be there. Okay. Next is abnormal reflexes including hyperreflexia, absent reflexes and a positive Bevanski's reflex. Emotional changes such as apathy, euphoria, irritability and depression. Memory changes and confusion. Here you can see in this image, we will discuss the main symptoms of multiple sclerosis again. Like centrally, the patient may have depression, fatigue, cognitive impairment, unstable mood. Throat, here patient may have dysphagia, that means difficulty in swallowing, muscle weakness, cramping, spasm, lack of coordination will be there. And senses, increased sensitivity to pain, tingling, burning, pins and needle feeling, that means paresthesia will be there. Visually, the patient may have nystagmus, optic neuritis, diplopia. Mouth, patient may have difficulty swallowing the food, dysphagia as we discussed. Sudden slurring or stuttering in the speech. Urinary, frequent urination, incontinence will be there. Digestive system, sudden changes in the urinary frequency, constipation, diarrhea, etc. So these all are the main symptoms. Like with these symptoms we can assess this disease. Okay, clear? Next we will discuss about its intervention. What we can do with this disease. First of all, provide bed rest. Bed rest during the exacerbation. Here you can see. Protect the client from the injury by providing the safety measures. Place an eye patch on the eye for diplopia. Monitor for potential complications such as UTI and contractures. Promote regular elimination by the bladder and the bowel draining. Encourage independence. Assist the client to establish a regular exercise and rest periods. Clear? Assess the need for and provide assistive devices. Initiate physical and speech therapy. Next, instruct the client to avoid fatigue, stress, infection, overheating and chilling. Instruct the client to increase the fluid intake and eat the balanced diet including the low fat, high fiber foods and the foods high in potassium like banana. Okay. Instruct the client in safety measures related to the sensory loss such as regulating the temperature of the bath water and avoiding the heating pads. Instruct the client in the self-administration of the prescribed medications. Clear? So this is all about the intervention. So today we have discussed about the multiple sclerosis, its assessment, how we can assess this disease and what are its intervention. Hope this small video is clear to you all. Thank you.